Hi everyone, and thanks for joining us, and thank you for your patience while we resolved a small technical issue that has delayed the start of this webinar today. I apologise for the delay, but hopefully we've got it all resolved and ready to roll. My name's Michael Fotheringham. I'm the Chief Executive of AHURI, and I'm delighted to finally welcome you to the latest event in our AHURI Research Webinar Series. Before we begin though, I want to acknowledge that I'm hosting this webinar from the lands of the Wurundjeri people of the Kulin Nation, and also acknowledge the traditional custodians of the various lands on which you're all working today, and the Aboriginal and Torres Strait Islander people participating in this webinar. And I offer my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters throughout Australia. Now, AHURI is pleased to be able to offer this research webinar series as a means of keeping you informed of our latest research and to help you engage with research findings from our ongoing program of research activity at a time when our public face-to-face conferences and events are, of course, still on hold. And so today is our 8th instalment in the series. And if you're interested in the previous 7, well, the recordings are freely available on the AHURI website. And I'd encourage you to have a look at that. I'd also encourage you to have a look at the COVID Research Hub on the AHURI website. So before we meet today's presenters and I introduce you to the topic for the webinar today, I just want to take a moment to introduce you to AHURI's revamped COVID-19 Research Hub live on our website. We first created a COVID Hub back in March as a platform to host relevant news and our own analysis of key policy decisions relating to housing, homelessness and cities in response to the pandemic. We also commissioned the COVID-19 Research Agenda, 8 research projects to answer some of the most pressing policy questions in this very unusual. 2 of those reports have already been published on the website and are accessible via the Research Hub, and there'll be plenty more in the series coming out before the end of the year. Okay, on to some housekeeping. Before I introduce today's topic and speakers, I need to just provide you with a few instructions on the software and how to use it. This webinar is being recorded, so if you need to leave, or for that matter, if you want to return to it later or have another look at it, forward it on to a colleague, the recording will be on the AHURI website in the next few days. And at the end of today's webinar, you'll receive a survey. We really do welcome your feedback so that we can continue to refine and improve our webinars for the future and ensure that we're presenting information in a way that's useful to you. In terms of participating in today's webinar, the instructions are fairly simple. By default, you're listening to your computer's speaker system, but if you prefer to listen over the phone or through other means, you can select the telephone option in the audio pane and the dial-up information will be displayed for you. You'll have the opportunity to submit questions by typing them into the questions section of the control panel. And you can submit your questions at any time, starting right now, throughout the presentations. And we'll collate those and address as many of them as we can in the Q&A segment following the presentation today. But look, just ignore the raise your hand function as we won't be using that. Now, today's topic and presenters. I'm delighted to welcome you to today's webinar, Integrating Housing Support for Vulnerable Families. I do want to acknowledge the generous support of Beyond Bank, our exclusive sponsor for today's webinar. In 2007, the Beyond Bank Foundation was established with the primary purpose of giving back to the community and supporting many challenges faced in society, like housing affordability and supporting older Australians and disability support. And we thank them for their support. Our main presenter today is Kylie Valentine from the University of New South Wales, the lead author of AHURI's research project, Inquiry into Integrated Housing Support for Vulnerable Families, which is the basis for today's webinar. The inquiry investigated how housing support for vulnerable families experiencing domestic and family violence can be best integrated with other types of support to enhance safety and wellbeing. The report, along with a policy evidence summary and a standalone executive summary, is available on the AHURI website, and the address is coming up on your, or is there on your screen now. Look, it's also available as a download in the handout section of this webinar dashboard, so it's right there. You don't even need to leave the webinar. As I say, Kylie Valentine is our first speaker today. She's Deputy Director of the Social Policy Research Centre at the University of New South Wales and leader of the inquiry. And Kylie is joined for key parts of the presentation by 3 colleagues who authored supporting research work within this inquiry. Chris Martin from the University of New South Wales, Kylie Cripps also from the University of New South Wales, and Kathleen Flanagan from the University of Tasmania. So it's now my pleasure to hand over to Kylie Valentine.
Thank you, Michael. And I've got to say, if this whole AHURI thing doesn't work out, you've got a great future in podcasting. You just made COVID sound like a really appealing thing with your spruiking of the research hub. Good morning, everybody. Thanks for joining us. I would also like to begin by acknowledging country. I'm on Bidjigal land today. Sovereignty was never ceded, and I pay respect to elders past and present. So the way that this is going to work is that I'm going to speak a little bit at the beginning and a little bit at the end to top and tail the findings that my colleagues are going to present. And although this is an integrated project and the content is about integration, it was very much a collaborative effort. And that's because one of our key findings and actually one of our points of suspicion when we started off was that integrated does not mean one size fits all. So an integrated system does not mean all of the different bits go into a single system and that will work. So it's simply not possible to talk about integration for vulnerable families in a way that breaks things down into like a single kind of solution. So Kate, could I have the introductory slide, please? Okay, so I'm sure that it's no surprise to most people who are here today that integration has been a policy priority for some time, and that's because it's recognised that vulnerable groups who are experiencing homelessness or at risk of homelessness often require multiple forms of support, and a single agency or a single support network can't provide that. And also that when things go terribly wrong, it often turns out that it's fragmentation, poor coordination, poor transition points from one service system to another. So building on that priority and building on the kinds of frustrations that we've been hearing for many years about lack of coordination, we had a kind of key couple of questions, which was, how can housing support be better integrated with other forms of support? Importantly, what's working at the moment, what can be scaled up and improved, and also what are the big gaps? And as I said, we recognise that some groups of people are particularly at risk. So even though integrated support is something that should benefit everybody, it's not going to benefit everybody in the same way. And that some of those groups that are particularly vulnerable have also been subject to particularly inconsistent policies and practices. So they've been, in a way, despite the recognition of their priority status and their vulnerability, have been a kind of case study for how not to do integration well. So we focused on 3 primary groups, recognising that there will be crossover between them: Indigenous and non-Indigenous families, particularly women and children who have experienced domestic and family violence, and social housing tenants, particularly that group who have been identified as engaging in criminal or antisocial or the term that was preferred in this project, misconduct. So I will hand over to my colleague Kylie Cripps, who will talk about the first priority population. Thank you, Kylie. And Kat, could you put it on Kylie's screen, please?
Thanks, Kylie. I pay my respects to our traditional owners on the land on who we meet as well. Our project looked at Indigenous populations, and our key findings were that Indigenous women and children have very limited housing pathways to choose from in the aftermath of domestic and family violence, that there are acute shortages existing in crisis, transitional and long-term housing, particularly in regional and remote areas. And as a consequence, Indigenous women are trapped in a revolving door, cycling between crisis services when they're available, as well as sheltering with family and friends and returning to an unsafe home. Our findings also spoke of long delays in placement on priority housing lists, and then in securing housing, with some women reporting waiting between 2 to 8 years before being provided long-term accommodation. This had particularly devastating consequences for those who had children apprehended by child protection, with the likelihood of them being reunified with their children being almost impossible. In terms of service integration, whilst law and policy reform in this respect has improved service integration generally, it often fails to meet the needs of Indigenous women given its one-size-fits-all approach. Instead of supporting and improving Indigenous women's circumstances, service integration had the potential to compound their disadvantage and to further disempower them, particularly in its intersection with child protection, with many Indigenous women particularly vulnerable to child protection involvement, such that Indigenous women's victimisation could be described as a situation of triple victimisation through domestic and family violence, the removal of their children, as well as being a victim of homelessness. And these had long-term consequences. The study was useful in highlighting areas for improvement, the most obvious being an increase in housing stock. That I also urge you to go to the report itself because it's useful in looking at the other policy and practice implications, but also potential solutions in that space. I'm going to pass over to my colleague Kathleen Flanagan now at University of Tasmania to talk about the implications and findings for the non-Indigenous population. Thanks, Kathleen.
Thank you, Kylie, and I too would like to acknowledge country. I'm going to talk about non-Indigenous women, but I want to note that non-Indigenous women do include migrant women, and their situation is worth keeping in mind because often it's not just their finances, but their visa conditions that force them into dependency on their perpetrator. Our findings suggest that for non-Indigenous women, the crisis response is reasonably effective. Most, though not all, women who had to leave their home were accommodated by crisis services, in shelters or brokered accommodation. And many women spoke highly of these services and of their support workers. But beyond the crisis response, the picture was less positive. It was clear that policy frameworks within other key government support systems were not necessarily directed at the same objectives as the family violence service system. For example, the income support system provides inadequate support within a suspicious and punitive framework, and that's not a good start. Many women we spoke to or heard about were in significant poverty, reliant on emergency relief, or economising on household expenses beyond what is reasonable. Income and housing are also profoundly interconnected. Given the centrality of housing to good outcomes, it is surprising how little attention there is to housing within national and state family violence policies. I'm not saying it's ignored, but I am saying it's low key. There is an assumption that the rest of the housing system will play its part, but we really do know, that the housing system is often unable to play its part. The policy expectation is that most women leaving violence will move into private rental, and there are various subsidies and guarantees designed to facilitate this. But even women who received this support found private market entry difficult. Their circumstances, single woman, kids, low income, domestic violence, placed them at a substantial and sometimes insurmountable disadvantage in the marketplace. Most were eligible for social housing, and social housing is relatively affordable and secure, but the well-documented shortage of social housing often closed off this option as well. The consequence of women not finding housing, or only finding poor quality, insecure and unsafe housing, is that they return to a violent relationship. And that makes the shortfall in social and affordable housing supply one of the biggest sources of risk in our family violence system. I'd now like to hand over to Chris Martin, who will talk more about the social housing system.
Hello all. Thanks, AHURI, thanks, Kathleen, and respect to the Bidjigal and other First Nations. I'm talking about social housing, and as the other presenters have indicated, this is often the desperately sought destination for vulnerable families. I'm talking about social housing and its responses to crime and antisocial behaviour, and the the tensions that can create for an integrated support response. So social housing providers are operating under an imperative, often pressure from their political masters and from tenants to take action on crime and antisocial behaviour, to crack down or get tough, including through tenancy termination and eviction. But social housing providers also have a genuinely felt commitment to sustain tenancies and to respond in more ameliorative ways to crime and antisocial behaviour. So there's a tension there, and my part of the research was in how that tension plays out in practice, and we'll talk today particularly about how it plays out for women, particularly as they're affected by domestic violence or male misconduct. So social housing practice, social housing providers enter into tenancy contracts with tenants. These have terms relating to nuisance and annoyance, illegal use of premises. They provide for vicarious liability. Tenants are responsible for their other household members and visitors. As a result, a very wide range of matters can become framed as tenancy matters and brought to the attention of social housing landlords. When we spoke to stakeholders in the area, we saw generally that there's an initial response by social housing landlords to the wide range of matters that come before them, often to state that the tenancy may be at risk, there's a threat to the tenancy, but also to invite engagement. There's an exception in relation to drugs, to complaints about drug use and drug offences. That's often met by a zero tolerance response, and housing providers go straight to termination in those cases. Otherwise, most of these matters don't proceed immediately, but where problems persist, we heard there was often this process of trying to engage tenants, and it was often an unsatisfactory process of trying to engage them in support, but failing to do so, and just escalating threats to the tenancy until it gets to termination. And termination proceedings in tribunal, and a real deterioration in communication and trust, and loss of tenancy. Particularly for women, we looked at tenancy tribunal cases, and we looked at 95 cases from tribunals. 60 involved women. 20 of those involved past or present domestic violence, and in 10 cases, the domestic violence was part of the problem that brought them to the tribunal and to termination proceedings. In 34 of the cases, so about a third of the cases, the misconduct complained about was misconduct by a male relative, and that doesn't go the other way around. So domestic violence and male misconduct is often framed as a tenancy breach, and for which a female tenant can be held responsible. We've made some recommendations around law reform in relation to tenancy law and vicarious liability in tenancy agreements, but I think there's also a need within social housing providers to shake up that framing of domestic, that leads to domestic violence being framed as a tenancy problem, through perhaps a gender impact review, or efforts to take support, this idea of engaging in support, out of the shadow of termination proceedings. Back to you, Michael.
Thanks, Chris. I think Kylie, Valentine, you were going to wrap up at this point on the presentation side.
Yes, that's right. Kat, can we have the next slide, please? Thank you again to my colleagues. So to sort of summarise, I think what we have found through the 3 projects, and looking at this from a sort of policy and systems point of view, just to say that nobody thinks that integration is a bad idea. Everybody is aiming for it. It's kind of impossible to argue with, and in many cases we found really good examples of this at a local practice level. Practitioners tend to be really good at doing integration in an everyday kind of way. So linking in with local services, making sure that referrals work, making sure that if there's capacity issues with the first place that they go to, that they go somewhere else. So local collaboration and integration is often working pretty well. However, there are clear gaps that remain, and they're often at the sort of policy implementation or systems level, or as Chris was just kind of being really clear about in terms of the his own kind of study. There are tensions between the policy goals in one area and those in another. For those of us who have been working in the sector for a long time, I think the conflict between child protection priorities and other kinds of priorities remains an extraordinary frustration and extraordinarily intractable, because it has been identified for a long time as something that represents a kind of tension in terms of providing family support as opposed to escalating child protection interventions. But we can also see that there are tensions between policy priorities on supporting vulnerable families versus those about maintaining social housing and making sure that wait lists are fair, and between supporting women and children experiencing family violence and child protection, as I said, but also in terms of like providing long-term housing. So there are kind of good intentions in individual sectors that tend to clash when they come together, which is obviously a problem for integration. And there are also tensions we found, and I think Kylie's project probably found the most of these, between policy principles and local service practices. So one of the things that again is impossible to argue with is the benefits of trauma-informed support. Often that is not possible, not because people don't believe in it or they don't like it, but because it requires resources that are simply not available. There is also, unfortunately, many instances of suspicion and local poor practice because of workforce capacity or other resource issues, or for reasons that we weren't able to kind of analyse in terms of causality, but they were clearly there. And obviously between the Aboriginal Child Principle policy and prioritising removal. So those high-level policy principles of integration don't always translate to practice on the ground, even though practice on the ground is often very effective. Could I have the next slide, please, Kat? So we started late, and Michael, I'm assuming that there are questions.
Well, in fact, none have come through yet, so I would encourage people to type in their questions. I know we had a technical issue that delayed our start, but you should now be able to see a questions panel, everybody. So please feel free to type in your questions at any time. But go ahead, Kylie.
Yeah, I was going to say if there's lots of questions, I'll race through this quicker than I otherwise would. But if we're giving people time to think about what questions they want to ask. So the reports do cover this, so I would encourage you to have a look at the reports if you're interested in what we recommended in terms of policy development options, and they are policy options rather than service options in most cases. Although, as I said, we did identify areas where policy aspirations and policy principles were not translating into local practice, and that was often, for reasons that kind of made sense on the ground. It's not that it was mindless or was a big mystery, but nevertheless was at odds with both the policy aspirations and the broader goals of integration. So we haven't kind of necessarily covered the data that led to these recommendations in the presentation today. I assure you that they do make sense and they are backed by evidence. So for the specific groups, we had specific policy development options for supporting Indigenous families, and really this is such a need. Indigenous landlord organisations and Indigenous staff in mainstream organisations, including housing organisations. Really, housing and homelessness has a lot of work to do in terms of Aboriginal controlled or even culturally safe for Aboriginal staff organisations. To make changes to tenancy law, policy and practice to recognise cultural obligations and extended family responsibility. So the default model is not of a Anglo-nuclear skip family. Invest in building the cultural safety of mainstream services and systems so they are more effective for Indigenous families, and as we've said, address the tensions between family support, which very much prioritising a strengths-based approach and keeping families together, to child protection policies, which are still very much based around risk management, particularly with really young kids, and removing kids as an early rather than last ditch measure. Could I have the next slide, please, Kat? For integrating specialist homelessness services, which remain, as we know, one of the really critical points of first response for people who are experiencing homelessness, particularly at the crisis end. There are options for better integrating those services with the broader service system, increasing resources in affordable housing options, particularly safe, secure and supportive social housing. As we've heard, social housing is a very much preferred option, and there are lots of great things about it. However, as Chris has identified, there are punitive practices that go there that are at odds with that. So it's not just it's not just the usual more social housing call, although it is that, but it is also make sure that social housing is regarded as a safe and secure long-term option for vulnerable people. While there's reliance on the rental market and on private rental subsidies, there are things that need to be done or that could be done to address the different levels of affordability and availability of housing in this rental market. It's obviously going to be a variable market based on location and other things. However, there are lots of places where the subsidies and the logic just doesn't work. So if there's reliance on the rental market, which there is, work needs to be done to make that work more effectively in more places. To align existing local practices, and here's an example of things that could be built up. There are lots of good examples of local practices that are integrated, collaborative, flexible, agile, all that stuff, also trauma informed. And so if there is goodwill and opportunity to build on those, to scale them up, it's not that there's not good examples out there. There are, but they tend to be pretty specific and pretty local at the moment. And obviously, well, maybe not obviously, but it is something that is obvious to us. Income support policies, while there is an enormous amount of people living in poverty, although we've heard in the last couple of days that apparently it's not something that's supported as a concept by the current government, so there is work to do on that. But if we accept that there is such a thing as poverty, and we accept that there is such a thing as a social security safety net that places people in poverty, this is a way of integrating housing with broader social determinants of wellbeing and health. While people live in poverty, obviously their options for housing as well as all other kinds of things are going to be extremely limited. And the next slide, please, Kat. I think that this is my last slide. Integrating social housing practice with other service systems, as Chris mentioned, so I won't reiterate it. Gender impacts, but for social housing, the best interests of the child in tenancy termination decisions affecting children, and in fact, although that best interest of the child is contested and woolly, and there's all kinds of things that go wrong with that, it would also be of use in a lot of child protection cases as well. Is it really in the best interest of the child to remove them from their parents? Even though, you know, I think that there's a lot of evidence that that's not always the case. A permanent commitment that no one will be evicted into homelessness. I think that the COVID response has shown that it is possible and that it can be done. And so the next argument is, can it be done long term? Improve integration between housing and child protection. Change tenancy law regarding extended and vicarious liability. So this is to Chris's point again. and adopting harm minimisation principles. So a health response rather than a criminal or surveilling response to alcohol and other drug use, and also mental health use in social housing properties. And again, to kind of underline that that a lot of the rationale for the suspicion and poor practice at a local level was not because practitioners were, so far as we could tell, evil or lazy, but because they were often incredibly mindful of the rationing and the wait list for services. And so particularly people who had been around for a while, their sense was not, I don't care about this, or I don't care about service integration, or I don't care about providing a good service. It was, I have, 6,000 people wanting this service, and these people kind of are just a pain in the neck. They're recalcitrant. They keep doing these bad things. Why should this very nice refugee family that have been waiting for 2 years and got nothing keep having to wait because of this family that keep doing the wrong thing? So it's a function in part of a kind of responsibility to a ration service system, as well as being, just bad practice for other reasons. So I think that's it. And Michael, I'll hand back to you. Thank you. And I think we all come back now like the Brady Bunch.
Yeah, no, I'll invite the other speakers to rejoin us, and thank all of you for that presentation, for the insights you provided. It's there's a lot of work there. There's a lot of really fascinating material, and obviously some very sensitive material to work through. A handful of questions have come through. I suspect we're still having some technical issues with the question section. So if anyone's having trouble accessing the questions panel and unable to put a question and would like to, I suggest just logging out of the webinar and back in again, and it should revive it. I know a number of people got bumped off when we were having a technical session, so apologies again for that. But some really interesting questions coming through, and I guess question primarily to Kylie in the first instance, but really to all of you, on the impact of COVID on the issues you've addressed here. So the question was particularly framed around women leaving violent homes, and how much harder that is during lockdown. But I'd be interested in each of your thoughts on the impact on COVID on this work. Kylie?
Which Kylie? I can start if you want.
Sorry, Kylie Valentine.
Yes, so it is very interesting because, of course, the domestic violence was one of the things that was flagged pretty early as an extreme risk for escalation during COVID, because obviously financial stress and other stresses are a big risk factor. When people were in lockdown, they were going to be spending more time together, which adds to stress. And women's options for calling for help were likely to be very much reduced if the perpetrator was there with them all the time. So this has been something that has been on, and also lessons from overseas were that in some countries, violence went through the roof, both the incidence of it and the seriousness of it. So the sector was supported in a couple of different ways to respond to that. And I think that the findings so far are mixed in that, yes, there have been increases in incidents of economic abuse, in coercive control, in people's options for leaving being much curtailed. It's very hard to kind of leave a relationship when you're in lockdown, and when you've been stood down from your job. The messages from the sector in how they've been able to respond to that are mixed in that some organisations are very pleased with the way that they've been able to adapt and to support clients more readily. Of course, the big risk is, or the big worry is, what kinds of stuff are happening that nobody knows about because it's so hidden. Again, there are kind of reasonably creative responses to that happening. So safe spaces in shopping centres, for instance. In Spain, there were kind of safe words, or I think it was in Spain, there were safe words that could be used at pharmacies, because women often have responsibility for grocery shopping, so there would be kind of safety measures set up while they were for that. But yes, I think there have been some terrible effects of COVID, some positive responses from COVID in terms of the capacity of the sector to respond, and we won't know for a while. And I realise that this is a long answer, but I think one of the things that we found in this project, and one of the things that we find with domestic violence more generally, is that there is a really high visibility of physical violence, particularly lethal violence. And so everybody wants to hear about or know about, the stories of people getting killed, people getting beaten up, people getting admitted to emergency. That's really important. The risk of a focus on that means that other types of violence, including economic abuse, which is incredibly pernicious, has incredibly long-term effects, just doesn't get recognised, doesn't get the same kind of priority. And when people are living in a forced intimacy, coercive control and economic abuse and emotional abuse are obviously hugely risky.
Other members of the panel want?
Yeah, I was going to say, Kylie gave a really comprehensive answer to what's sort of happening at the moment. I guess I just wanted to add two things. From our project, which obviously our data collection took place prior to COVID, so I was just thinking through how COVID might have affected the experiences that women were reporting prior to COVID. And one of the things that really came out from our project is the amount of labour that we demand of women who have left violence in terms of the admin of, getting their income sorted out, looking for houses, going into all different agencies, sorting stuff out with the school, sorting out custody arrangements. There's a lot of work that we expect women to do, and obviously that work would have been harder under social distancing and those kinds of restrictions. The other thing I wanted to add, and it's something that's coming out in the COVID research that Michael was talking about, is a significant concern about what happens next in terms of the next steps in terms of the drop in the amount of JobKeeper and income support payments back down to normal levels. And I guess the uncertainty that we're all feeling about how long is this going to go on for? Is there going to be another wave? What happens next? All of those kind of things. I think when you're in crisis and your head is in crisis, all of that adds to the difficulty of trying to find a way through.
Absolutely.
I agree with. Oh, sorry.
Go ahead, please.
I agree with the comments of Kylie and Kathleen as well. For the Indigenous community, the risk of COVID is quite high, and many of our communities went into lockdown quite early, and some of our communities remain in lockdown to keep our communities safe. And there's been some controversy around that in terms of do our people have good access to groceries? Do they have good access to medications and the like? And do people have access to get out of those communities, to come and go as they please in those kind of contexts too? So it's a moving space in terms of thinking about people's safety in that context, particularly for those that are victims of violence. The other important points in terms of Indigenous community and COVID in relationship to domestic violence is that we've got all of those issues there, and I think that there's also the importance of in raising the issues around domestic violence and COVID. We had at the same time the issues around the Black Lives Matter movement, and the deaths in custody that were hitting our social media during this period, and we also had a number of social media posts around how our young people were being engaged with by police during the COVID period. So that would have had quite an impact on our women as they made a decision, I suppose, around do we ring the police to get protection in situations of domestic and family violence. And we understand that, you know, it limits our opportunities in terms of how do we respond to this. And so one of the things that our communities have been doing a lot around in this period is around safety plans. So making sure that not only do our victims have safety plans, but that family members and friends of our victims are also safety planning with the victims. So that if the victim sends a text message or they give a code word to their friends or family, that those members will act on their behalf to make sure that they get safety and get out of the situation that they're in. So it's thinking of the practical things that they can do in these moments if we can't rely on the police, for example, in a situation of crisis, because that's been the reality for many Indigenous communities in the present time, that they have had an increased fear in relationship to the police.
I might just say quickly, if you don't mind, about terminations and evictions and COVID, because we have had eviction moratoriums. All of the states and territories, none of them had complete moratoriums, and all of them made some provision for termination proceedings on grounds of serious violence or property damage or breach, or indeed a wider range of things in some cases. So we haven't had complete eviction moratoriums. Just as to how many termination proceedings or evictions there have been from social housing or from other landlords, we can't say. We do data on terminations and evictions in Australia really badly. The research for this inquiry sort of drew together what it could from tribunal records and tribunal decisions, but we really don't have regularly published data about evictions and terminations, and that would probably be I'm sure it would be a useful check for social housing providers and other policymakers on practice in this area and how it affects people.
Totally agree. I mean, look, we could spend the rest of the time talking COVID. It's obviously a huge impact on every system throughout our society, throughout our economies. It's profoundly changing everything. So, AHURI's work, as I mentioned earlier, we've essentially addressed three key questions. What were the impacts? What were the housing and homelessness impacts of the initial pandemic? What were the policy responses, and how did they operate? And then what are the opportunities for housing and urban policy to support economic recovery? And some of the work we've released already looks at people's experience in the private rental system and the construction sector, but we've got work coming out next week that looks at policy coordination and a range of other pieces out through the rest of the year. There's a lot more to say. We've been holding policy exchanges internationally and nationally, looking at opportunities to share learnings between jurisdictions, between countries, and there's a lot more work to do. But let's perhaps turn to the research again and some of the questions that arise from it. There's a wealth of really interesting questions flowing through now. So thank you for your patience with the technology today. One question is I guess a clarification on the system. Are there current policies or programs relating to provision of housing specifically for women-headed households in terms of affordability and safety, and both short and long-term options, that would help to address the need for housing for women leaving violence and who could address diverse needs? Who would like to respond to that?
I can start and then others can add. So, I mean, yes, there are programs. There's a range of kind of what are called safe at home models, where the sort of intent is to remove the perpetrator rather than the victim. There are various programs designed to support women and children into the private rental market, subsidies, rental subsidies or assistance with bond, guarantees, so that the state effectively is the guarantor on the rent being paid. Various measures at the kind of the local level to work with real estate agents to facilitate pathways out of crisis housing into longer term options. The social housing system, obviously. So that there definitely are programs that exist, and sometimes quite creative and effective programs, but the issue is with scale and with in some cases an expectation of the wider housing system that simply can't be delivered under our current policy settings. So the expectation, for example, that if we provide a rental subsidy, that's enough to get women over the line into private rental, when we know that there are so many other aspects of the private rental market that work against women in vulnerable situations. So that's kind of, that's what I'd say. I don't know if Kylie or Chris or Kylie have anything else to add.
I think one thing. Yeah, you go, Kylie.
I was just going to say, so if the question is about women-centred, women-led households as opposed to programs to assist people leaving violence into housing, I don't know of any. Kathleen's just mentioned those programs and subsidies for the former group. But yes, it's an interesting point. If the question is more about women's economic empowerment with or without the experience of domestic and family violence, it's an interesting idea. I'm not aware of any programs that exist on that.
Well, Kylie Cripps, did you want to add before I sort of make a comment there?
Yeah, the only comment that I really wanted to make was that in terms of in the Indigenous domestic and family violence survivors, the important point is that in our research we found that they were largely excluded from the private rental market because of racism. And, you know, I remember quite vividly one particular interview where the victim said, I've got an English name, I can apply online. I turn up to the interview and to pick up the keys to go view the property, and I turn up and they say that I'm an Aboriginal woman and the property's gone. But Kylie, that property is still listed on realestate.com. You know, it's not about you know, it's about racism. It's not about that anything else. So we need to be recognizing that the limits of what's available for Aboriginal women is quite serious, that they rely on public housing or community housing.
I guess just an observation from me that it speaks to the level of coordination and integration of policies and programs if the framing of the question is around women-led households or around escaping domestic violence changes the answer. Really, the wording of the question shouldn't be the decider of whether something is available. I guess, you know, the other part I wanted to add is that there are specialists in the community housing system that focus on women-led households or housing women, and so, you know, there is certainly room for more of them. There's only a handful at the moment, less than a handful, of providers specialising in that space, but certainly opportunity for growth there. There was a question of clarification about the research generally and its applicability to rural areas. To sort of what extent did the research sort of address regional and rural spaces?
Kathleen, I reckon you can. Kathleen and Kylie,
sure.
you can do.
So the fieldwork for the part of the research that looked at non-Indigenous women encompassed pretty much statewide in Tasmania and a mix of urban and more regional centres in New South Wales. I guess a couple of points that come. One is obviously the density of services that are available in rural and regional areas drops quite markedly, and certainly I'm obviously more familiar with Tasmania. There are parts of Tasmania that are we're a small state, but there are parts that our geography makes incredibly isolated, and sometimes perpetrators know that, and they deliberately live in those areas for that reason. And that's certainly applied in New South Wales as well, where services simply weren't available in an area. The other issue is that there is a kind of implicit assumption that housing in regional areas is cheaper. And while that might be the case, sometimes in other cases, local regional housing markets are actually very expensive. So other factors might influence the market. If there's seasonal work, the market ebbs and flows with that, or if there's a big construction project nearby, the market will be affected by that. And so we were finding a lot of stories. Sometimes women want to leave an area to feel safe, but other times they want to stay in an area, either because there's a custody arrangement that means they have to, or because they want their kids to be at the same school or whatever. And regional housing markets aren't always flexible enough to accommodate women staying. So I guess that was kind of something that really came out, particularly say in Tasmania, where we make assumptions about, say, the northwest coast is a really cheap place to live. Well, actually, women had just as many problems finding affordable housing there as they did in the south. Kylie, I know you have things to say.
So our study also looked at the regional and remote areas, particularly in New South Wales, as well as in the Northern Territory. And it was interesting, particularly when you look at it in the Northern Territory, because you've got hubs where people will come into particular areas. So, and you've got social mobility in ways that people will be moving into those hubs for medical reasons, for community service reasons, for legal reasons, and then they'll move back out onto community. So sometimes the services won't necessarily be available on community because you need to go into places like Katherine, for example, because all of the services are located into Katherine. But people will also move into places like Katherine or Alice Springs or the like because of the wet season as well. So the need for housing in both the community but also in those hub areas is really important, and the costs of living in those areas is very high, not just in terms of rents, but also the costs of food and all of those kind of things that is exceptionally high, not necessarily how we'd envisage it in other places around Australia. And when you factor that in the context of the income that people receive, it becomes quite an expensive place to live in terms of thinking, how do people survive in these kind of contexts? And so that has to be considered in terms of, how do you rebuild your life in the aftermath of domestic and family violence? And particularly because one of the things that we found in our research was that many of these women will come out of domestic and family violence having a housing debt, not realizing that rent hadn't been paid by their partner, or that there's been damage to the property. And often the delay in putting them on a housing priority list was because that debt has to be partly paid prior to them being put on a housing priority list. And so when you're thinking about the limited income from Centrelink, for example, then the high cost of rental markets, the high cost of living, it becomes a really difficult place to get out of the bind that they're in the aftermath of domestic and family violence. And we really need to be thinking about how do we support people in these circumstances rather than just layering more and more difficulties on them in those circumstances. And so our report does talk to the point of how do we respond to that housing debt issue, identifying it as a really significant issue, and that we actually need to prioritise it as something that shouldn't hinder them in getting housed in a longer term.
Thanks, Kylie. Was probably not so much a question as a comment that I'll actually read virtually verbatim. I'll just de-identify, but working in transitional housing, we see the chicken and egg event regularly where we have child protection reunification not being able to move forward without the offer of housing, and they're not being able to provide that access because the tenancy requires the children to be there listed with the applying parent on their Centrelink statement. So it's all frustratingly circular. I think that's describing exactly the sort of scenario you've been talking about. There's a couple of comments here about the federal budget and social housing that we can largely take as read, but I guess picking up from the absence of a large scale investment in social housing construction at a Commonwealth level, there are some positive noises in some of the states, but beyond that, probably a question for you, Chris. Are private rental subsidies the next best option? Is that where we turn, or how can landlords be incentivised to support that?
Well, coincidentally, there is a new AHURI report out today on private rental subsidies on Commonwealth rent assistance. So webinar attendees can check that out as well. Look, the private rental sector, it is, aside from the rent assistance question that we can get back to and talk about, but that's only part of it. It's private rental. It's insecure. It's chronically unaffordable, and it doesn't provide access to so many of the people we're talking about. It's not an option to rely on that sector to house people, not just vulnerable people, but we should be looking at that sector as starting to compete with private landlords and drive up the standard of their offering. I think that's where the focus, not for vulnerable families, but also for a general improvement in the way our population is housed, can be driven by a bigger, more confident, not-for-profit housing sector that is growing. And the federal budget went backwards on that. I mean, it set out that each year going forward, there will be less spent on our social housing system, and it's utterly the wrong response.
Yeah, I mean, the rationale for the social housing system in the first place was that the private market does not do the job. That was the reason why we have social housing, is because there was recognition in the 1940s that the private rental market did not work for a substantial portion of the population. And I don't think that has changed. So the justification that we don't need social housing because we have the private rental market is fundamentally misplaced, I think. And hear to everything that Chris said.
Thanks.
So would you like me to come back to the rent assistance question, or should we save that for another webinar?
No. Well, look, we will be doing a webinar on the rent assistance question, and I guess in very brief form, it modelled a number of reforms to Commonwealth rent assistance to improve its targeting, its appropriateness, that would actually, in fact, save money for the government, drop costs by about $1 billion, but actually get a better outcome. So it's a fascinating piece of work that's well worth the read. Did you want to say something about it?
I would just say that on rent assistance, as Michael indicated, there's a report out today. There's a few issues about the way rent assistance currently works, and that is it's not terribly well targeted. So the way it currently works is that there are quite a few people, in particular, if you're not on a social security payment, if you're just a low wage worker, you don't get rent assistance, you're not eligible. So there's people who don't get it, who are in rent stress. There are people who do get it, but they're still in rent stress. It's not enough. And then there are quite a few people who get it, but they're not actually in rent stress. So there's a targeting problem. There's always been an issue to a question in the sector about whether more CRA means it just goes into higher rents. And the research looks into that and suggests, the modelling it undertook suggests that generally it doesn't have that effect. There are some market contexts, particularly disadvantaged areas, where it does seem to, where a fraction of it does appear to go into higher rents, but generally it doesn't. So there is a reform agenda around CRA that could improve affordability outcomes for people, but it'll never do it'll never do what's required in relation to improving legal security. That's another reform agenda. Access or anti-discrimination, another reform agenda, or housing supply in those disadvantaged areas, which needs a non-market response. That's another reform agenda.
And I'll just say quickly that that in terms of the other kind of bit of private rental for vulnerable groups, including women and children escaping domestic violence, also young people, also there's other groups, but there's specific ones for vulnerable groups. They're kind of underpinned by logic of temporary support while you get back on your feet and then you move on. And there is a kind of policy, almost preoccupation with the idea of transitions and pathways, you know, like you start somewhere and then you move somewhere else. And if you do find yourself in social housing, that's a temporary thing while you go on to something else. And still, I think there's this kind of idea that private rental is a stepping stone to buying your own house. And for many women who have experienced domestic violence, it's not feasible to say, we'll give you a subsidy for 12 months and then you're on your way. But in general, the way that housing prices and housing markets work, it's not feasible for anyone. So one of the reasons why private rental subsidies for vulnerable groups keep changing in terms of the time that they're available is partly a market thing, partly because quite often they're designed by people who have never spent a day as a sort of tenant in their life, so have kind of no idea of like what it's like or what the market's like. But part of it is a kind of misunderstanding of the long-term effects of trauma such as domestic violence or other kinds of adverse events on your capacity to just, you know, get better, move on and stop asking for help. So I think if that assumption was kind of dropped, and if the assumption of if you are anywhere like social housing or in any kind of housing support, you are on your way to somewhere else, that could improve things as well. You know, people don't want to be on a pathway necessarily. Housing is something that should be more secure and permanent than that.
Look, that picks up on one of the questions that's come through, and we actually have a wealth of questions. The discussion is clearly stimulating people's thinking. We have more questions that I suspect we'll get to, but we'll do as much as we can. Really picking up on that trauma-informed practice that you alluded to just now and also a little earlier. Kylie V, can you give some examples of best practice in sort of trauma-informed practice or trauma-informed policy?
No, certainly not. It's more than my life is worth. It is such a contested area. We could do a whole project on what people mean by trauma-informed care, and it would take us forever, and people would still hate it. So one of the reasons I think why it is so dominant is it's because it's quite a flexible category, and people from different disciplines mean different things by it. And again, it's kind of inarguable. You know, like if you put out a practice guideline now, just try putting out something that doesn't mention trauma-informed care. You know, like it's one of those things that is just, you know, impossible to argue with. However, one of the really striking things that we found in Kathleen's project was one of the principles of trauma-informed care is that you provide environments that are safe and not traumatizing again. And when people are being asked to move into shitty caravan parks or hotels where there's stains all over the mattress, or into areas that they regard as unsafe, not only is that something where people are going to say, yeah, no thanks, I'll stay where I am because at least it's my house and it's my stuff. It's actually the opposite of trauma-informed care. You know, when you look at the practice guidelines, it's all about providing a space with, you know, like aromatherapy and like not too many windows and, you know, like space for the door, you know, like really thoughtful work on the environments that are supportive. A lot of providers have, you know, the opposite of that. And again, that's not because it's, you know, they're evil or they don't care. It's a rationing and resource issue. If you need to speak to somebody in a shared office that's really noisy and, you know, like and people can't see the exit points or people can come up behind them, you can't be doing trauma-informed responses with the best will in the world and all of the, you know, kind of training that you've done. So, so I think that it is one of those things where, yes, everybody sort of agrees with it. Everybody should be doing it. There is, I think, a high expectation that it's a kind of attitudinal thing and it doesn't cost anything to do properly. And the more you kind of speak to people who are very passionate about it or who mean what it originally meant as well, you realise that it's got astonishing resource implications that are not being met in many domestic violence specialist services, let alone many housing providers. And when people can do it properly, they really swear by it. It is something that's regarded as effective if it can be done. People want to do it. It's not that they don't want to do it. It's not that they don't know how. It's that it requires resources, and those resources aren't being a nice person. Like we mean material resources, and often they're just not available.
I'll move on to a really interesting question that's been posed here, which probably sits a little outside the focus of this research, but I'll put it to the panel, and I suspect you'll all have views about it, Kathleen and Chris in particular. You know, would it be rational to really decentralise housing policy to local government level, to enhance responsiveness and early intervention, to be locally appropriate, rather than being a sort of jointly federal state shared and disputed obligation? You know, so for example, in the UK, they have council social housing. Is that what we should be doing?
Well, council in the UK means, well, works differently to the way our councils work for a start.
Yep.
Their councils are more akin to state governments than local councils. I mean, I guess I would look at it with a Tasmanian lens on, because obviously I'm in Tasmania. Some of our councils are tiny. Even the big ones lack the resources to really do that kind of thing well. That's not to say that the current buck passing between federal and state necessarily helps either. I mean, you did say I would have things to say, Michael. Look, I mean, I think there is a tendency to think that we can solve the housing problem if we just get the right governance model or the right policy design or the right strategy or the right framework. It really is about resources, and in a way the governance frameworks and the policy designs and the strategies, none of them will work without resources. So I think it kind of it's not the answer to just say, well, if we just change the way that it's administered, everything will be fine. Everything will not be fine because the system is chronically starved of funding.
Yeah, the point I'd make is that no level of government has the power, the fiscal power to organise the resources necessary to house people properly, like the national government does, like the federal government in Australia does. And their fiscal power is not just of a different degree, it's a different kind of power to be able to spend to get stuff done. And that's been one of the lessons of the COVID response and some of the income support measures, that to respond to a problem, to mobilise resources in our economy, the Commonwealth Government can spend, and there's no limit to what it can spend to get stuff done, and it needs to get stuff done around housing. Now, states and even less so local governments cannot spend in the same way. That said, the states still can do more, and they still have a power to, they can still mobilise resources in a way that community sector organisations can't. They have fiscal powers to, whether the delivery of services is best done by locally organised, community-oriented organisations with a civil society organisations with a particular ethos. I think there's a case that's to be made for that. But in terms of the basic ability or capacity to mobilise resources for the housing tasks that our society faces, no government has that like Commonwealth Government, and they've gone missing.
All right, thank you for that. Having 3 tiers actively coordinating would be even more challenging than 2 tiers is proving to be. So there's not to say that I think local government shouldn't have some role, but I don't think we can just pass the buck that easily. I guess following on from that, one of the questions that's come up a couple of different ways in the feed I'm seeing is really, how do we ensure that policymakers, that governments see this work, see these recommendations, and have the opportunity to act on them? And I might just make a couple of remarks on the AHURI approach to that, and would welcome the panel adding to it. But this was part of the work presented today is a snapshot from a broad inquiry of work, an inquiry being a program of a number of related projects, as each of the speakers have articulated. And that's overseen by a program management, which involves an inquiry panel, so a selection of key stakeholders from the federal government, from state governments, from relevant service sectors and industry, key stakeholders who provide advice and insight into the work early on in the process, and as the findings are being analysed, give some feedback, some commentary, help to contextualise the work so that the final report is as relevant to policymakers as possible. So there's an early engagement there. We also distribute the work to governments directly ahead of publication, and provide a range of tools to help them do that. There's a policy evidence summary as one of the handouts available today that provides, I guess, a fairly short form and glossy cut of what are the policy implications of the work, and all the depth of finding and research is there in the full report. So there are a couple of tools there. AHURI will continue to put forward this work to policymakers as we do with all of the work we publish. But as a system, that's how we work towards it. But I guess there's opportunity for others to pick up on the work and do advocacy with it as well. We don't consider AHURI to be an advocacy group. We're a research institute, but we're very open to lobbyists and advocates picking up on the work and running with it. So perhaps the panel might like to speak to the other things that can be done with the work. Or have I said too much?
I'll just make a point quickly, and it's about a word that I'm conscious that I've used a few times in discussion today, and it's also in the research report too, and it's about framing. It's the framing of issues, and this is what we came across in the research, talking to social housing landlords who are obviously genuinely committed to responding in a supportive way and supporting the housing of women affected by domestic violence. And it's a genuine commitment there, but the circumstances of tenancy management and the framework of a of a landlord-tenant relationship and tenancy agreements that have contractual terms about nuisance and annoyance and vicarious liability and all the rest. It changes the response. It changes, that framing changes the way social housing providers respond to women in these circumstances. And it was happening we saw it in the tribunal cases as well. There are looking at the tribunal decisions where they refer to nuisance and annoyance, and they refer to all of these incidences of fighting and screaming coming from a household. And if they don't call it domestic, it's domestic violence. You feel like saying to the member, dude, it's domestic violence. It's not shouting and screaming, but it's that. So it's the framing, and if, as well as a systemic, a law reform agenda in the case of tenancy law that could be pursued. I do think social housing landlords and workers can themselves shake the frame up a little bit by deliberately trying to look at a problem from another perspective, or refreshing how they do in terms of the gender impacts of their tenancy management, and so I think that framing is an issue for getting some of these changes across.
Thanks, Chris. Look, we've run out of time. We've gone just slightly over, and again, apologies for our late start and the technical issues we had early on. But we have reached the end of the webinar, and I want to thank our presenters once again, Kylie Valentine, Chris Martin, Kylie Cripps, and Kathleen Flanagan for their insights and their presentations today. And I'd like to thank everyone for joining us for what has been quite a fascinating and wide-ranging discussion. Let me also once more acknowledge the generous support of Beyond Bank as today's sponsor in making today possible. Our next webinar, coming up in a week or two, the official invitation will be arriving in your inbox tomorrow. So join me on Thursday, the 5th of November, I beg your pardon, Thursday the 5th, at 11 a.m. Eastern Daylight Savings Time, when we'll host the webinar, which was originally planned for October 15, but had to be postponed. I'll be joined by Lyrian Daniel from the University of Adelaide, who'll present findings from the AHURI research project, Warm, Cool and Energy Affordable Housing Policy Solutions for Low-Income Renters, along with Kerry Connors from Energy Consumers Australia. So it'll be a terrific discussion there as well. I'd also remind you that the 2020 National Homelessness Conference is coming up. It'll be held online for the first time as a virtual conference on the 1st and 2nd of December. And of course, that conference was due to be held in Canberra back in August, but was cancelled for 2020 reasons. The online conference will adopt the theme, The Year That Changed Homelessness, and we'll really have a chance to examine how the pandemic has impacted people experiencing or at risk of homelessness, the policy and practice responses during this unprecedented year. So I'd urge you to register for the conference. The program is growing every day and promises to be a really robust symposium of voices from Australia and internationally, a lot of international speakers for this. And a quick reminder that we'd really appreciate your feedback by completing the short survey that'll be sent out to you, probably in your inbox right now. And if you want to share this webinar with colleagues, it'll be on our website in the next few days. So until we see you again, thank you for joining us today.